Yeah, Kathy, I'm ready to start.
Yes, sir.
Kathy, do you want to give an introduction or shall I do it myself?
So, hello everyone. We have Dr. Rajkumar sir. Uh, so, I think you can start, sir.
Okay. Uh, Good evening, everyone. Please forgive the anxiety in Kathy's voice. I was a former boss, so that's that's why he's a little anxious. But thank you, everyone, for attending this webinar. There's 26 of us on a Tuesday evening, no less, on a weekday evening. I really appreciate the enthusiasm and your time and effort to join this webinar. And I really hope there are some few important takeaways at the end of this webinar. Let me introduce myself. My name is Rajkumar. I'm an emergency physician by practice, and I head the department of simulation at Aarupadai Veedu Medical College in Pondicherry. I've been about 7 years in simulation, right from the beginning years when simulation was still a novice thing, even before NMC mandated it. I chose simulation as a career path because I strongly believed in the effect that simulation can have as a teaching pedagogy. And I will tell you why I believe that strongly, right? And why I think simulation will also change us as teachers. That's the core essence of why I chose this career pathway. Now, through these years of simulation, I worked in a corporate simulation lab. I've headed two major medical college simulation labs, and yeah, I'm still exploring and understanding and learning every day as we speak. Uh, for example, just last week I was in Kathmandu for an entire week, trying to understand how simulation is growing there as a small prospect, right? How people are doing simulation in lower resource countries and things like that. And through all these travels, I realized that after heading one of the most expensive simulation labs, so-called expensive simulation labs in the country, I realized that having an expensive lab is not what it is said to be. It's not what people make it to be. In fact, utilizing a more expensive simulation lab is even more difficult than a low resource, absolutely minimal simulation lab. Because those mannequins, those expensive, high tech, high fidelity mannequin, cater to a very, very specific audience. And maintaining them always comes with a sense of anxiety. If I want my students to use one of those high tech mannequins, I'll always be on the edge. What if they break them? Even if you have an expensive mannequin, you're probably thinking to yourself, I'm not fully comfortable letting my student use this mannequin to its full extent, which kind of defeats the purpose. You have an expensive mannequin, but you're not able to fully utilize it because you're also worried that it might break. Students might break it, which really does happen quite a lot. So, this paper came out, digitalizing simulation landscapes, right? That is a paper that we wrote. Me and Dr. Lulu wrote this paper, and this paper came with my enthusiasm for tech and my enthusiasm for app-based simulation, right? So I did a similar webinar about a year ago called Virtual Bootcamps, as in how can you tap into the potential of online learning for conducting virtual simulation courses, right? That webinar is still live and visible on the YouTube channel of Society for Healthcare Simulation India. I'll ask Kathy to share the link at the end of the lecture. But this lecture is completely different. It's not similar to that lecture at all. This is using simulation tools which are available online, most of them for free, in fact, to teach your students currently without having the need for expensive, big shot, high tech mannequins, right? That's the goal. How do you digitalize the simulation landscape? How do you convert traditional mannequin based simulation to a hybrid modality by using digital tools instead? And this paper took quite a lot of effort. We had to dig into the depth of internet and find rarely used websites which are now abandoned but still useful, websites we are constantly updated. Like the other day I learned about a new website, so it's an ever growing and blooming system, and fortunately for us, simulation is a very small community in India, right? And all of us are still learning and teaching each other. So that's a fantastic thing about simulation, right? We're all new to it. We don't know how to do it, and that's the thing about simulation. It's very amenable. It's very amiable. It adapts to what you know. There is no single correct definition of what simulation is in India right now, and that's what makes it beautiful. But there are some underlying principles which we as simulation educators are expected to follow, right? Like the basic concept of psychological safety. And that brings us to the core of simulation. We are creating a safe space for our learners, right? Our learners are in a safe space where they can feel free to express themselves, where they can feel free to commit mistakes, where they feel free that they won't be judged, right? And that brings us to simulation as a teaching pedagogy or a teaching andragogy or teaching heterogogy. I'll start my lecture now. Let me share my screen. Okay, one a second. Kathy, can you please confirm if my screen is visible?
Yes, sir. It's visible, sir.
Okay, right. So digitalizing the simulation landscape. Like I said, we're using apps, applications, and websites and digital tools to convert simulation from what is right now, right? So my name is Rajkumar Elanjeran. I'm an emergency physician by practice. I've left emergency medicine now and I've gone into simulation full time. As part of my simulation curriculum, simulation career, I'm a regional faculty for the American Heart Association for the Asia Pacific region. I'm one of the people who controls and audits the HA centers in India. I'm a course director for National Disaster Life Support Foundation USA. I've traveled abroad to teach disaster life support courses. I recently graduated from the FAIMER fellowship program with Manipal and University of Philadelphia, and I'm in charge of simulation at Aarupadai Veedu Medical College, Pondicherry. We are a deemed university, and that gives us a little bit of freedoms to do simulation as such. And I'm also the program director for Jeeva Raksha course at my college. Now, learning started off very traditionally through this. If you look at Indian system of learning, if you look at the Indian system of Guru Siksha Parampara, right? I'm sure many of this heard of this a lot. Many of you still quote this to this day. Yes or no? Guru Siksha Parampara, right? Where we talk about students teaching their teachers like gods, right? We give them the utmost respect, and to some extent, that also implies that we follow whatever they say blindly. But that's not essentially true nowadays, right? We are dealing with a different set of learners. We're dealing with a Gen Z, millennial, extremely self-centered, independent-minded learner, right? And there's a certain generation gap between us and our learners. A generation gap of 10, 15 years where the application landscape, the digital landscape, the mobile landscape has exploded in many ways. And we are not abreast with what is happening with them. And most of the times when I see my students use some app, I'm surprised that this app even exists. When I see them fiddling on their phone, I'm like, what are they doing and why am I not aware of this? It creates a sense of inferiority complex. And the response to us that usually is we buckle down and we put our foot down on the own system of learning that we are used to. We don't try to adapt to what they're learning and how they want it, which is why maybe these apps are more successful. Marrow, Prepladder, etc. are more successful because they adapt to those learners' mindsets, you know. And I really don't think they're doing a great job at it. That's for another debate altogether. But that's where we are right now. There's a generation gap. There exists a very stark generation gap between us and our learners. Earlier, it was between OHPs and learners. Then it was basic PowerPoint and learners. Then it was animations and learners. Then it was videos and learners. And now it's simulation and learners, right? But truth be told, we have no choice. We have to adapt to these learners. We cannot go by traditional systems of learning where you dictate to a classroom and the learners just listen to you single-handedly. It doesn't work anymore. So I'm glad all of you are here to learn from the system. Now, pedagogy, andragogy, and heterogogy. You see this last slide, it's a very interesting image. The teacher and the student are equal, not in a very egocentric way, but in the way they respect each other, right? Let me give you a very common example that I quote when I teach my students about simulation, right? I'm sure most of you have gone through some degree of ragging in your college. Not most of you, all of you. Some ragging has happened to you, irrespective of where you are, what background you're from. You have been ragged in your college, right? From your seniors. Most of you have also ragged your juniors. Heart on the hand, definitely you've ragged your juniors. And that basically comes from the understanding that I've been ragged, so I will also rag someone. Right? This happened to me. It's not fair that my junior gets away without all this. It has to happen to him too. And that's where traditional learning systems have stuck on. The concept of a student being thrown to the classroom, a student being told off in front of 100 people, a student being called incompetent in front of other people. It comes down from the existing mentality that this happened to me. It's not wrong to happen to someone else below me, right? मैंने ऐसे ही सीखा था तो ये भी ऐसे ही सीखेंगे. And you feel that you learned the best possible way like this because you were taught this way, and you feel that this is the best way to teach someone, and that means you have to step back now, and you have to understand that our learner today is much more psychologically insecure, if I may. I know that's a very controversial term to use, but they have been taught about mental wellness and self-respect and things like that in a lot more broader terms than we have, and they take it very, very seriously. So it's time for us to adapt to these learners and treat each other as one. That's basically heutagogy, right? And the concept of simulation essentially is three things, right? When you look at, okay, that's the learning principles where your student believes that he's equal with the teacher, right? Of course, I'm not saying that he questions you and disrespects you and things like that. It just means that he feels close enough to ask you questions, to address you directly and learn from you without feeling threatened in a psychologically safe space. Now, when you look at a simulation case as such, it has three parts to it: pre-brief, running the case, and debrief, right? The pre-brief also involves some part preparation. Now, I'll try to talk about the different tools available in the landscape to use simulation for all these three different entities of simulation. Excuse me. Now, if I may, I want you all to defocus from the slide for a minute and talk about why simulation actually works, right? There might be a question from many of you that why do we even use simulation, right? What is the proof that actually works? The proof is there, but more often than proof, it's actually common sense, right? And to exhibit this common sense, let me demonstrate to you a curve, a bell-shaped curve. You know the normal distribution curve that you learned in community medicine in your statistics classes, the normal distribution curve, the Gaussian curve, which is a bell-shaped curve, right? So the bell-shaped curve has two extremes to it and a center peak, right? One extreme is lower end, the other extreme is lower end, but you have a center peak on top. Now, simulation fits into this normal distribution curve, but of course, everything fits into the normal distribution curve, and so does simulation. So look at the normal distribution curve. Imagine a classroom where you have a PowerPoint slide, no videos, no animation, just a bunch of text, and your students are sitting in front of you, and you are lecturing and lecturing and lecturing, right? This is low stimulation. I'm not talking simulation, I'm talking stimulation. I'm not being mistaken here. I'm not using the wrong terminology. I mean stimulation. The stimulation at this level is extremely low, and so are the outcomes. What the students learn from this class is very, very low. What he'll actually take away, what he'll actually retain is quite low, right? Look at the other extreme. The other extreme is probably a residency period. In your residency period, you are expected to learn by doing on the patient directly. Yes, you're doing your first resuscitation on a patient. You're doing your first intubation on a patient. You're doing your first major central line procedure on a patient. When you're expected to learn, you're expected to retain all that information. The stress is very high, and so is the learning. In both cases, the learning is low, but in one case, the stress is minimal. In the other case, the stress is too high. The consequences of a mistake are way too high. If a mistake is made, the patient dies. The amount of stress that the student has is extremely high, right? So we don't want such low level of stress. We don't want such high level of stress. What we want is eustress. We want eustress. Yes, eustress is actually a word. You might be wondering, did I come up with this word? I didn't. It's actually a word. Eustress is the word, is the thing you want to create through simulation. You are creating a similar stressor, but the student knows it is safe to commit mistakes. The consequences are not so high as a patient's death. So this peak, where performance peaks, happens in simulation. Does that make sense? Can somebody please respond with a yes? Is the class still on? Hello?
Yes, sir. Yes.
Oh, fantastic. Okay, great. I was a little worried because continuously talking. I thought people were mistaken. There you go. Okay. So
Yes, sir.
creating something called a eustress, right? So creating something called eustress where the stress is there, stress is present and palpable, but the consequences of the stress are not so severe. Patient is not going to die. The mannequin can die n number of times, right? So this was proposed by Yokes and Dodson. It's called Yokes-Dodson curve, YORKAS Dodson curve. And this is my core belief in simulation. I believe simulation works because of this curve, right? And it makes absolute sense to me that you create a stressful environment so the student can perform to the best of his potential while the consequences are not so severe, right? That's simulation for you. And the cardinal principles of simulation, there are 4 cardinal principles of simulation. The first, the student needs to suspend disbelief. He needs to believe that the scenario is real. That's the first fictional contract. Second, Vegas rules. What happens in Vegas stays in Vegas. Similarly, what happens in simulation stays in simulation. Mistakes are opportunities for learning. This is where I want to introduce a concept called good judgment. Good judgment. Now, what is this good judgment? We all heard of judgment. None of us wants to be judged, right? In our relationships, in our mistakes, in our families, in our workplace, we all don't want to be judged, right? But the basic assumption of simulation is we judge them with good intent. We judge our students, but with good intent. What does that good intent mean? Which means I believe that my students are intelligent, they're capable, they care about what they're doing, and they want to improve. They're adult learners. They're self-motivated. Nobody comes into medicine with the goal of killing people, right? Sure, you might not be motivated as the others. Your motivation will be completely different. Maybe to make money, maybe to make a name for yourself, whatever it is. But the core intent is that you don't want to do any harm. Isn't that the first line of our oath, right? Do no harm. So that's good judgment. When I judge a student for his mistakes, my judgment lies on the bottom line that I believe that my students are intelligent, they're capable, and they care about what they're doing, and they want the best for their patients. Now, with that thought, when a student makes a mistake, I care for him. So the other principle I want to know now, which is not mentioned here, is love thy learner. Love your learner. Your learner is someone you should love, not be disgusted with, not feel petrified about, not want to hate, not feel like you're burdened with. Love thy learner. So that's the core principle of simulation. Judging with good intent, good judgment, and love thy learner. Right? That's your cardinal principle of simulation. Now coming to simulation scenario itself, every simulation scenario ideally will have these core clinical outcomes, right? There'll be somebody on a team lead, there'll be somebody who's charting, somebody who's airway, somebody who's medicine monitor. This is what all of you thought simulation is, but this is not simulation. This is a very small concept of simulation. We're talking about teamwork. Simulation can also be teaching auscultation. Simulation can be teaching individual skills. Simulation can be teaching communication. Simulation can be teaching crisis resource management. So there are several perspectives to simulation. Now, if you look at simulation as creating a scenario, because you're all teachers, you're not learners now, you're all teachers, you have 1, 2, 3, 4, 5, 6, 7, 8, 9 jobs to do. You have 9 jobs to take care of, right? So what are these 9 jobs? First, you're supposed to create an environment of simulation. You're supposed to create a very realistic environment where the student believes that he's in a real scenario. Second, you're expected to script a scenario so that a standardized script can be followed by not just you, by anybody else who's following your script. Remember, you're not the only person doing simulation in your center. There'll be other faculties too. So your script should be so well defined that if someone else is coming and doing simulation, they can just refer to your script and do it the exact same way it was intended to be done. Does this make sense? So first one is environment, where you create a hyper realistic, a high fidelity scenario around you. The second is you create a script that is replicatable, right? Third is high tech, right? You want to use as many vital parameters as you can to make it realistic. Remember, high tech does not mean essentially high cost, which is what I want to talk to you about today. You also want to instill a sense of communication with your mannequin, that your mannequin can talk and respond. You want to include vital monitor, where you can show vital parameters. And if you're teaching critical care, you want to use ultrasound and ventilator. And at the end of all of this, you want to assess the student. You want to know whether whatever is done so far fits into your picture, fits into what you're actually looking for, fits into the core competencies that the NMC wants. So you want to assess your student. And you want to have minimal involvement from your end. You want the simulation scenario to be as realistic as possible. In real life, when the student is facing a patient, you're not going to be there lecturing him, telling that tumhe ye karna chahiye, tumhe wo karna chahiye. The communication happens naturally, and we want the simulation to happen naturally as well. So that is essentially what you have at your hand for simulation. So All these images are from my paper. It's available online. It's a completely free downloadable paper. But I will take a deep dive into some of the apps I use on a daily basis, some of the more interesting apps that you will also find. First, let me open my browser. I hope the screen is visible. Yeah. Okay. Now, scripting a scenario is very important, right? I told you that you have to essentially have a script. Can you confirm that my screen is visible? My browser is visible?
Yes, yes, sir.
Thank you. Right. Okay. Um, as part of scripting a scenario, you're also expected to create some pre-established parameters so that when the student asks questions, you're prepared for it, right? And one of the most important pre-established parameters is creating a report, right? Now, all of you will open Word document, you'll type individual parameters, you'll open Google on the side, you will copy paste everything like that, right? But here exists a website called simlab.researchstate.io where you can create ready-made reports with already normal values and you can modify it as per your need. So you can generate new report, you can change the report settings, you can have parameters for anion gap, basophils, NT-proBNP, chlorides, creatinine, eosinophils, whichever parameter you want. It is limitless. The list does not end, right? And once you click on it, it will show you the normal parameters and you can simply edit it and upload the new parameters and you can print it to PDF. It's as simple as that, right? So this is called simlab.researchstate.io. As you can see, you can just click on Microsoft Print to PDF and you can print it, all the parameters. And you can ready-made show this to your candidates. So I found this extremely useful. I cannot tell you how much I depend on this website. It's simple, it's straightforward, and guess what? If you type a parameter which is way too unrealistic, it'll tell you. It won't accept the report, right? If you give, let's say, an ABG of patient of a 6.4, it won't believe you. It'll deny that ABG report, right? So it's tuned and adapted to realistic learning. So you can use this to generate reports. Now, one more thing when it comes to creating or scripting a scenario is creating learning objectives. Can someone tell me what tool we use for creating learning objectives? What is the mnemonic?
Smart sample.
Yeah. There are a few, but the most accepted one is smart learning objectives, right? Fortunately for us, there exists multiple AI tools. And guess what? If you log into one of your chat GPTs or your Google Bard or your Pilot, Microsoft Copilot, it will help you create learning objectives with smart learning objectives. Straightforward, right? You directly go to chat GPT, you directly go to Google Bard or you go to Google Copilot and you say create learning objectives for second year medicine students for area management. It will give you smart learning objectives in a jiffy, right? And all you have to do is edit it to your needs. So there you have it. There you have it. Now we're becoming AI experts. You can use AI to create smart learning objectives and save you a ton of time, right? One of the core things I learned as a teacher, a simulation teacher, is that technology is your friend, not your enemy, right? In your classroom, I'm pretty sure 100% of you, the moment you enter a classroom, you'll tell, switch off your phones, put your phone in silent mode, put your phones in your pocket. I disagree. Ask them to open their phones. You tell them what to do on their phones. Don't let them do whatever they want. You create a lesson plan. You structure your class in such a way that you make them use their phone for your benefit. Use quizzes, use apps, use Kahoot, use Mentimeter, use Google Forms, as simple as that, to ensure you engage your learner through the class using the smartphone. Can we have simulation for first year students to measure blood pressure? Dr. Modi shall get back to you on that. It's a good question. Yes, there's in fact a fantastic simulation tool for that. I'll get back to that. It's not there in my paper, but I will type it in the group, in the chat box, right? Okay, so like I said, not to deviate from the point is love thy learner and love their skills. They have excellent smartphone skills. So you learn to love those skills and you learn to use those smartphone skills in the classroom to your advantage, not to theirs, right? So if a student is good at something, the student is very good at something, that's what you want to do. It's our job as a teacher to adapt to that system. And in my classroom, my first rule when I start classroom classes, make sure a phone is fully charged. I'm going to use it fully in the classroom. And it's up to you to how you're going to use it, whether by quizzes, whether by online polls and things like that, right? So the first thing first, The smartphone is your friend too. The smartphone is not your enemy. Do not start a classroom off saying that put your phone in silent mode, put it in your bags. I don't want to see any smartphones on the desk. No, let there be phones. Let there be light from the phones. Let the students use their phones. Use it to your advantage. And one of those ways is using quizzes and things like that. So coming to smartphones again, coming back to the point of smartphones, like I said, you can use ChatGPT to create and script scenarios. Now, how to script scenarios? If if learning objectives are not clear, if you don't know what to do with learning objectives, you're too busy, right? There are also ready-made tools available online where checklists and learning objectives are already available, right? Let me quote to you two websites. One is called Sim Cases. This has simulation cases ready-made for all the major systems. You just have to click on it. Let's say OBGYN, right? You just have to click on it, and yeah, you can see all these cases ready-made. You can click on one case and give you a script ready hand, right? So again, another great tool for you to do a simulation scenario.
Sir, we are not able to see your screen, sir.
Oh, I'm sorry, I stopped sharing. Just a second. Thank you, ma'am.
Okay.
Thank you for reminding me. Yeah. My bad. Yeah, this one is called. Is my screen visible now?
Yes, sir.
Yeah. This is a free website called Sim Cases. In fact, when I first learned about education, I was introduced to a concept called FOMED. Can someone expand FOMED for me? What is FOMED? Anyone in the group? I'd love it if I can hear any of you speak about it. It's very famously used on Twitter and x.com. Basically now it's called x.com. So anyone FOMED? Kabhi suna hai aapne? Don't Google it, please. If you know, you know. Okay, FOMED stands for Free Open Access Medical Education. Free Open Access Medical Education. It's an entire new trend in the online doctor community, in the online medical community and nursing community, where we share our resources openly and freely, right? We don't subscribe to paid and printed journals. We want open access journals. Similarly, FOMED, Free Open Access Medical Education. So that's essentially why these webinars are done too, on a free basis, right? We want to teach. Another example is how Pedistars does webinars in India as well. Almost all their webinars, all the webinars are free and open access. Anybody can join them. Anybody can listen to them, right? So yeah, if you just Google FOMED resources, FOAMED resources, you are treated to a whole plethora of available, established, validated tools to teach not just simulation but other things. So in the spirit of FOMED, let me introduce you to Sim Cases, which is one of the first emergency medicine simulated related websites which I found, which was in the FOMED realm, and it has case by category, for different categories: cardiology, communication, endocrine, communication. It might be Breaking Bad news, alcohol opioid use. So multiple cases. It just keeps going and going, and they keep getting updated. They keep getting updated every month by month, and you can also contribute to it, right? So that's the crazy part. And they give you a free template where you can simply tick mark and make a ready-made script. It doesn't even have to. Don't even have to waste much time, right? So this is one website that I extensively recommend for my people. Now, once that is done, let's talk about AliEM as well. So AliEM is another FOMED related website, which is called Academic Life in Emergency Medicine. Please don't think that my talk is completely emergency medicine. It is not. It'll get to other specialties as well. I'm just giving you a start, because emergency medicine, we can all agree, is something which is a basic thing to all of us. We want our students and our people to be able to handle emergencies in our subjects, in our fields, right? And that's the thing about emergencies. Some emergencies happen rarely, but they're high acuity, which means if something goes wrong, the patient will die. They happen rarely, which means the student is not familiar with it, which is why simulation is perfect to teach these high acuity scenarios, right? Where you can teach occurrences which are very, very rare, but they can mean life or death for the patient. Let me give an example. Can somebody give an example of the scenarios where the consequences of mistake are very high, but they end up seeing very few of those patients in real life? Anyone? A very dangerous scenario, but occurs very rarely. Could be anything in your field.
Amniotic fluid embolism.
Good. Yes, which can be easily simulated. Anything else? Any other scenario which is rare but needs to be taught to the students definitely, because if they miss it, the patient will die. Let me give you an example. In emergency medicine anesthesia, surgical airway, emergency front of neck access, very high acuity, very low occurrence in real life, but once it is required, the patient will die within a minute if you don't do it right, which is why simulation is the best way to teach front of neck access. Any other scenarios you can think of? Okay, yeah, right. Amputation, right. So hemorrhagic shock from amputation, very good. Yeah, that's another very good example of an incident which is very rare, but when it happens, it can be potentially life-threatening, right? So which is why I focus on emergency medicine simulation for everybody as such. Yeah, you can simulate these high acuity scenarios where the consequences can be absolutely brutal. Now, in that regard, these are two open access resources available. And Dr. Munish, since you asked a question, right? There is I'm typing it on the Google here, American Medical Association blood pressure measurement tool. Blood pressure essentials, it's called. It's a self-learning module. Here you go. It's a student edition one. I believe it is still free. When I used it, it was still free. Let me just open it. Yeah, it's done by the American Medical Association. So it's a step-by-step tool where you can you have to sign in, and it takes you through all the Korsakoff sounds step by step. What is the importance of each? And the student can self-assess and self-learn this module, right? So it's a very unique tool actually, if you look at it. So I will leave this link in your chat box, so all of you can go through it for blood pressure management. If Kathy and Shravanti are here from GSS Smart Lab, they would remember whenever second year students come to the sim lab, this is the first thing they'll do in my lab. They attend this course for free first. It's in fact bookmarked in the Smart Lab Google browser, if I'm not wrong. Still there. Yes. So this is one of the first things that we do in our lab. The student comes and does this free. It's a self-learning module, which is even more unique, right? It's completely digital. It has excellent simulation tools in it. It gives you a virtual patient. You can click on patient, measure systolic, and the cuff will inflate. You can decide when to stop the cuff. You can decide when to inflate the cuff. It's pretty cool. So you should check it out. It's not free anymore. I think it costs a few dollars, but I think for a one-time investment, it's probably worth it. Yeah. So that's the resource that I want to share with you. Now, these are two things that I wanted to also mention. EM sim cases and Ali EM Rescue Peds curriculum. Now, there are a few other websites which are very interactive. And let me go into the next part of that. We spoke about scripting, a scenario. We spoke about ChatGPT, and we spoke about book resources. Now let's talk about the environment. How do you make your environment realistic? Let me stop sharing for a second. Yeah. Now, how do you make your environment best to simulation? Can anyone suggest me? What do you think is the best way to make an environment similar to real life? What all tools can you use? Durga ma'am, I think you're online. Can I request you to please answer? How do you make your simulation scenario as realistic as possible? The environment, the hall. Okay. The best answer to that is by not doing it at all in the first place. Don't even take the effort. Don't take the effort to make the scenario real. Take it to the ER or the ICU or the actual ward. Cordon off one area, put some screens and do it in situ. And that's what we call in situ simulation. Dr. Sheikh Jasmine, cadaver teaching, very good idea. Cadaver teaching is good, but I'm telling you something better. I'm talking about the environment only, not the patient per se. So in situ simulation is something I want you all to look into, right? What is in situ simulation? Rather than bringing your students to a simulation lab, what you're doing is you're taking them to the real space, right? Obviously without disturbing the patient's peace and quiet. In almost all of your hospital, there might be one ward or one room or one ICU which is abandoned, or let's say left for respiratory intense cases or SARS-CoV cases, etc., right? Which is usually isolated, or the isolation ward. You can take your students there and use simulation. You do your simulation there. That's called in situ simulation. The level of fidelity the in situ simulation achieves is 100% because it's the exact same environment. You don't have to think twice about what you're going to miss. The suction machine there, yes. Is the oxygen port there? Yes. Is the air port there? Yes. Is the pendant there? Yes. So all the real life devices which you're actually using in the patient hospital are there. And you don't need to worry about cross branding. You don't need to worry about using cheaper equipments because you're using the exact same equipment that they'll be using in the real life, right? So in situ simulation is an excellent tool to create the environment that is close to a real life possible, right? Every now and then in my hospital, we do in situ code blue mock drills. I'm sure every single hospital of yours does that for NABH. For NABH accreditation and JC accreditation, you're supposed to create code blue, code black, etc. mock drills, right? And they're all based on the concept of in situ simulation. You take your mannequin, you put them in the ER, and suddenly you're on code blue, right? You put them in the ward, and suddenly on code blue. You see how your students respond, and you get them to respond better by training them in the same environment, right? That's essentially what in situ simulation is. That's your environment. Now we spoke about environment, we spoke about scripting, now we spoke about creating learning objectives. Let's talk about the most important one, which is multi-para monitor, right? So multi-para monitor, which is basically you want to show all the vital parameters on the screen. Now there are several paid apps and several free apps to do this. Of late, I've fallen in love with something called recessmonitor.com. I'm typing it in the group, recessmonitor.com. I will just show you in just a second. So you can all click on it and open it if you want to. I'll start sharing my screen and show it as well. There you go, recessmonitor.com. And all you have to do is change the session ID. Let me open it from my phone. It is free, by the way. All you have to do is open it on your browser on your phone. Same website on your phone browsers, go to it and click on recessmonitor.com. On your phone, you will create an option called Start New Session. There's an option called Start New Session. You click on that, it'll give you an ID. And you type that ID here. You use your phone as a remote control. The ID I got, I'll change my ID just a second. QJ cap small s capital VC 2H. Can all of you see it? Right? So as you can see, from my phone, I can control the vital parameters. Now you see I'm increasing the heart rate and making it into an arrhythmia, an SVT. And the moment I click apply changes, it'll change on the screen. It'll take a few seconds and there you go. I'll make the saturation drop now. Let's say that saturation to 70%, 80%. And I'll make the systolic BP drop to, right? With the waveform, I can remove the waveform if I want. I can close the ETCO if I want. So all these are possible in this tool. It's completely free. Now, the only thing, if you notice something, is there's no sound. There's no sound. That's one of the disadvantages of the tools. It was developed by a student who was learning programming. So obviously there are some lacunae. So what I did for that was I downloaded, just a second, hospital sounds for free from YouTube, right? What are hospital sounds you can expect? And I played in the background when the scenario is running. So obviously the sound and the rate do not match. The student is not going to be paying so much attention, but it creates a realism of the environment, right? A lot of environment is not visual perception, it's auditory perception, right? They have to hear background noises. They have to believe that this is an emergency room. So you can download these ready-made sounds from the internet. You know, ER sounds, monitoring the sound, beeping, people talking in the background. And if you listen in a bit, you'll hear a printer printing, right? Whatever happens in your traditional ER and ICU. See, all these sounds come in the sound. So you can download the sound from the internet and you can use that to simulate a monitor as well. So this monitor will come on your laptop. You don't need an iPad. You don't need an Apple device. You don't need an Android device. Any screen with a basic computer can work as your recess monitor screen, right? And it gives you all the parameters: ECG, D2, SpO2, ETCO2. And as you can see, it's pretty realistic. The rhythms look very realistic as well. Only the sound, which you can add from your phone, right? So that's one way to create the multi-para monitor. Now there are some other paid apps which are also available. There's one paid app called, I'm sharing it in the chat box. Simple, SIMPL, which is not available on Android now for some reason. SimMon it's called. SimMon, if I'm not wrong. Please correct me if I'm wrong. SimMon is there. There is also DartSim, which is available on only iOS, if I'm not wrong. Yes, only on iOS, DartSim. These are all simulation monitors, multi-para monitors. And most of them come with a defibrillator setup too. They have a defib console with a pacer console. So you can teach them defibrillation and pacing, right? Both demand and fixed mode pacing, transcutaneous pacing using these tools. The advantage of these tools, most of them are one-time purchases. If you can convince your management to spend, say, 5,000 rupees or 10,000 rupees, you'll have access to most of these for a lifetime in your hospital device, and you can use them as much as possible. And if you're not willing to invest that much money, you can use recessmonitor.com, which is free, right? Which is out there, anybody can use it, right? There's another app on Android which recently came up called SimMan. I haven't tested it out. If anybody has tested it, can please share. It's a good app too. That's what I've heard at least. I'm very comfortable with Resource Monitor and I'm very comfortable with Simple, so I use it most of the times. Of course, they come with a few gimmicks. You can figure it out over time, right? Does anybody know any other apps that you use for multi-para monitor vitals? Anyone else? Can you please share in the group if you can? I see a few more experts in the group. Arun Raj is here. If you can share your resources that you use, it'll be plenty of helpful for the rest of the participants. I'll learn something too. Does anybody use any other app for simulating multi-para monitors? Anand sir, anyone? Or this is list exhaustive. Dr. Soma Ganesh sir, another anesthesia simulator here. Sir, do you use any other apps?
So can you hear me?
Yeah, Arun, hi. Yeah, Arun, yes.
Hi. Yes. Sir, I'm not branding. I can say ladder leap application, we can use it.
Yeah.
And you need not to purchase it. Just you can download it from the ladder website where
Correct.
you can use it as a patient monitor without a license.
But you have downloaded the older version, right, Arun, if I'm not wrong? Version 7.2?
No. It is almost 8.1, sir.
8.1. Okay, right. Thank you, Arun. So yeah, there it is.
Yeah.
Dr. Joya, this apps are for simulating vital parameters, heart rate, ECG rhythm, BP, SpO2, etc. Right? There's another app called Leap application, which is from the Ladle website, 8.1. Okay. Dr. Sheikh Jasmine, Pocket Nurse, virtual simulator monitor, patient monitor. Thank you. I haven't heard of that before. Let me Google that quickly. Pocket Nurse, virtual excellent. So yeah, thank you all. You're all contributing excellently for the webinar. Like I said, the list of the resources I'm sharing today are by no means exhaustive, right? There are so many websites which flew under the radar, right? There's another website in my paper called Virtual Simbox. Yes, Virtual Simbox. That's also a free tool. Virtual Simbox, if I'm not wrong. Yeah, so Simbox is another free tool which is available online. There are numerous ones which are right there, you know. So you can use all this. Pocket Nurse, Body Interact, Virtual Patient Simulators. Okay, this is a paid version. Looks like it might be a little paid though. Okay, but yeah, let's explore those. So this is iSimulate reality as well. Yeah, these are also paid, right? I know about iSimulate as well. Then there is CAE SimEquip, which is also paid version. So these are all CAE SimEquip, correct? These are all paid apps, and Leap is free. So you can use these apps to multi-parameter. Only thing is, you need to play around with them, right? You need to take away time from your clinical practice and spend some time with these apps to figure out the nuances, what works and what doesn't work. That's about multi-para monitor. The next comes about more specific use cases, such as auscultation, heart sounds, lung sounds, and ultrasound and ventilator and more high-tech things, right? Believe me, if there is a clinical skill that has been taught, there is a simulator for it which exists, right? You just have to search for it, right? You just have to take a deep search of the internet for it. And if you want to assess a student, there also exists free assessment tools which are available online, right? So let me talk about ventilator for now, because that is something most anesthesia critical people will follow a lot. There is one tool called XLung. I'm sharing my screen. Hang on a moment. Yeah, there's one tool called XLung, which I'm sharing now. This is a tool. This is a tool I learned from my anesthesia colleagues, right? So XLung is a fantastic simulation tool for teaching ventilators. As you can see, the entire screen is simulated. Now I'm running the free version, which runs only for 2 minutes, but the paid version is not very expensive. For your 7,000 rupees, I think that's it. You can see the graphics. You can control the demographics. You can control the age. You can control. It will give you a ABG report, current ABG report. You can change the volume, tidal volume, the flow, the pattern. Everything can be changed, and it gives you live pathologies. Right. So here we have a normal intubated patient. You can make it ARDS severe. Let me show ARDS severe. Confirm. So with as many realistic parameters as possible, right? You have all these coming into your screen right now for a very minimal cost. You see the beep alarms speaking and going crazy right now. So you see the patient SpO2 dropping 31%. So you can show these very, very well, right? XLung it's called. It's made by South Americans. It's made out of South America. Not every simulation tool is American. So it's based in South America. So it's a fantastic simulation tool as well. And if you want something which is free, there is VentSim, ventsim.cc. You have to mail them for the free license. You have to mail them saying that, I'm a simulation person, I want to use it for simulation. They'll give you the access to it freely, right? And there you go. This is also another excellent. It's not the same. Obviously, it's not the same interactive as it is with everything else. But you can also see waveforms and things like that here as well. Ventsim.cc, right? Another excellent simulation tool. So some paid ones, CA SimEquip, and Ladle has a product called TrueVent. I'm typing it in the chat box as well. TrueVent is also an excellent simulation tool, but nothing comes close to what I found in Xlung. TrueVent. So these are all paid apps which are available online. You can get them, and you can use for ventilation training. For ultrasound, I have a very interesting tool. I have 3 tools actually. Rest of the 2 tools I'm not going to talk about because they are very, very expensive. Just a second. Awesome ultrasound. This tool, because it's so awesome, it's called Awesome Ultrasound. By name itself, it's called awesome. So the distributor, the guy who coined it, wanted to call it ultrasound. We'll play the video of it. It's unfortunately iOS based. It works only on Apple devices, but it works beautifully. Okay. Let me share the link in the group though. That'll be easier, I think. Is that okay? You can watch it later. Yeah, I'll share the group. Just a second. Somehow Google Meets doesn't play YouTube very well. So anyway, Awesome Ultrasound is an app essentially where you show it on your phone and use the tablet as a screen. If the student places the ultrasound probe on the lung, you can click a button and whatever lung ultrasound image you want will be visible on the screen like a real ultrasound, like a digital moving GIF, right? If you want to show echo, when the student places a probe on the echo, you can show that view using the remote. So it's just a remote control player, that's it, right? But it's beautiful. All the images are preloaded, right? You can select what pathology you want to show. You want to show aortic dissection, that is there. You want to show a dilated IVC, that is there. So all you have to do is the student places the probe, a mock probe. In my lab, what we did for the mock probe, we took the Logitech slide changer. The slide changer mouse pointer that you have, the Logitech black colored one. We removed the pen drive from it. We inserted suction catheter, Yonker catheter's tube, and we wrapped it up in white tape. So it looks like a proper ultrasound probe. And when they place that probe on the patient, we will change the screen on the iPad. It's as simple as that. Please, yeah. Yeah, Kathy, I'm following the chat box. Please let me know apps for surgical simulation procedures. Ma'am, I'm not a surgeon per se. Simulation procedures are very tough, but I believe there's an app from a company called I forgot the name. Just a second, I will just tell you. I've heard about these from my students. In fact, my students found out this app and told me about it. Yeah, touch surgery. Correct. Touch surgery. I'm sharing the. It's basically not a simulation app per se. It's just a series of instructions, which which gives you step-by-step instructions on how surgery should proceed with very nice videos. Similarly, for anesthesia, there's Nicora, which is for blocks, right? So these are 2 fantastic tools for teaching both surgical simulation and anesthesia simulation, right? Nicora is an excellent tool, world famous for teaching nerve blocks. Yeah. So we've learned about ultrasound simulation. We learned about the critical care simulation. What have I left out? I'm running short of time. Yeah, I have only 5 minutes left. Now, what I'll do is, in the end, I will share my paper in the group as well. That's the link to my paper. This quotes the things I've left out technically in my paper. And I'm sharing a few more resources for auscultation. This is free as well. Practical clinical skills auscultation. And there's another ventilator simulation from Open Pediatrics, which is also quite good. Open it somewhere here. Yeah, there you go. So Open Pediatrics has 3 simulators for dialysis and for ventilation for pediatric patients. And NEJM, the New England Journal of Medicine, they have a simulator for COVID-19 patients as well, which is a fantastic simulator by itself. And my favorite simulation of all is full code. That I will share my screen and show. This is my last topic. This is something I've been using since in anatomy. Yes, ma'am. Ma'am, anatomy is simulation is difficult per se. You have apps which will show you videos, and the most best one is 3D4 Medical by Elsevier. 3D4 Medical by Elsevier. I found it to be very effective. I found it to be beautiful, in fact, very close to real life, and it shows you kinesthetics and movements and sometimes physiological parameters as well. So that's a fantastic anatomy simulation tool. I see some more people posting here. There's an app called For Anatomy. You can use many mobile apps, which is the simulation tool. Okay, you can type human anatomy. Yeah, essentially sometimes all it takes is going to the Play Store or going to the App Store and just typing your specialty, and you'll find so many things. In fact, there are 2 simulators for physiology which I found. There's a simulator for ECMO called Harvey, for high level training, right? Harvey. So all you do is just Google search it. And I didn't make any of these apps. I don't take credit for any of these apps, but they're all available online and you just have to explore and search for these apps, right? I've quoted maximum number of these apps in my paper, but if any of you find newer apps, it's always good to share. That's how the community works, because I told you they're a very small community and we learn from each other. And in the spirit of FOAMED, free open access medical education, I encourage all of you to keep sharing, any resource that you find which is new. I'll also share. We have so many WhatsApp groups right now. There's a Telegram Telegram group called Healthcare Simulation in India. You can join that group where we share all the resources. It's a pretty dormant group now. It's not as active as MEU. Dr. Sanjay Bedi is here. It's not as active as the MEU group, but it's still there, existent. So all of you can share your simulation resources in Healthcare Simulation in India group. With that, I've come to the end of my talk. The one app which I want to talk about is, I'm sharing my screen. Some might have used this. It's called Full Code Medical Simulation, right? Again, it's somewhat free. Some of the cases are free. Essentially, you can open any case. There are 160 cases, different emergency ER cases, and most of them are not ER based. Some of them are just high acuity communication based cases. So is my screen visible now, Kathy? Yeah. Okay. So as you can see, you'll get a brief history of the patient, and you can move around the room. You can ask for help. You can attach. He's complaining of abdominal pain, as you can see, quite realistic, right? You can perform an airway exam. It'll tell you the result. You can attach the monitors, right? And once you attach the monitor comes visible. You can investigate. You can order investigations. You can say, if I get an X-ray, imaging. Yeah, if I get an X-ray, it will show me the X-ray as well as the patient. CT abdomen, as I said. With image will come, So student can interpret the image. This guy has an appendix right now. So you can ask him to image. You can set the level of difficulty and change the imaging. You can use the crash cart, right? Heavy cart action. You can get a differential diagnosis. You can call for consultation. You can do many things on the app. Full Code Medical Simulation. Beautiful app, which I use very commonly. So with that, this talk was basically an overview of what simulation is supposed to be, but what it's not. This is called Full Code, ma'am. Full Code Medical Simulation. Yes, Dr. Sulekha, that's an excellent point. Microbiology and pathology, there are things which you can actually simulate using simple tools, right? It's all about how realistic you can make them. Simulation is basically close to reality. That's what simulation literally translates to. So you can create blood, you can create colored smears, and you can ask the student to interpret. It's about how much jugaad you can use in your mind, right? There are plenty of jugaad things that Indians do, right? Because we are cheap, and that's a good thing about Indians. We are very cheap. We don't like to spend money. So when you're cheap, you invent new things and you find out new things, and that works very well for simulation. So I've learned a lot of jugadu things about simulation per se. For example, in our center, for teaching trauma log roll and applying a C-collar and pelvic collar, we bought mannequins from Amazon which are used for displaying clothes. You know the mannequins in clothes shops where they put the clothes on? It's a full body mannequin. It only costs 3,000 rupees or 4,000 rupees. We bought those mannequins because they can be rolled out in whatever way they want, right? So it's all about how you use your creativity and your mind. And the healthcare simulation Telegram link has been shared in the group. Thank you, Dr. Yogesh. All of you can join it. And please share resources that you're using, right? So I can learn a thing or two from you. Like I said, I'm no expert in this. I'm learning every day from the rest of my teachers and my learners. The only core concept of simulation is psychological safety, which I again and again insist on. Like I said, it's like ragging, right? We rag because we were ragged. We teach because we were taught a certain way. Let's change that, right? Let's come to a space where we can treat our students as our own equals, right? It doesn't have to be toxic. It doesn't have to be narcissistic. It doesn't have to be one-way approach. It can be two ways. Futurology. So thank you all for your time. With that, I will conclude my session. Khyati? Yeah. Any questions? Khyati, was the session recorded by any chance? No. Is it recorded? Okay. Please upload on YouTube on our channel. I'm sure they'll be able to see it. All these websites are linked in my paper in the resources in the references list. Every single website has been referenced to. You can simply open the paper and check out the references. It'll be there. Yeah. I thank the Society for Healthcare Simulation, my parent organization, which got me into simulation, for giving me the opportunity to speak on the platform. It's always been a pleasure. Thank you, Kathy, and thank you, Dr. Anand, for sitting through the session. Okay, there's a good question here. Any free application for OSCE? I forgot to mention that. Yes, there is a free application for OSCE. It's actually a beta tested application by Ladal, in fact. And I'm sharing the link here. It's a good question. I almost missed it. Just a second. 1 second. I'm sharing the link for OSCE creation. There you go. That's the link for creating OSCE. There's another one by Geeky Medics for creating OSCE. I'll share that as well. There's a website called Geeky Medics. I'm sure some of you heard about it. Geeky Medics is the leading website for OSCEs in the world. They have such extensive library of OSCEs, I can't even begin. Just opening the website. Yeah, there you go. Sharing the link here. Yeah, there you go. 2 links for OSCEs. Fantastic links. You'll never go wrong with these links. Some of them are paid. You can't get everything in the world for free. All good things have to be paid for, unfortunately. But trust me, if you're an institute, checking administration management, they're worth it. And it will not be as expensive as right? They're way cheaper. Way cheaper. I can run a full simulation lab with app subscriptions within less than 50,000 rupees, 50,000 rupees. Entire sim lab, including critical care training, just by subscribing to apps worth 50,000 rupees. That's it. So these are the apps in the link I've shared. If nothing, no other questions, we can conclude the class.
Actually, I joined a bit late. I mean, can we have some kind of a return on investment concept in simulation?
Sir, absolutely, sir. So let me explain, sir. Thank you for the question. Can I ask the rest of the audience to please mute? Okay. See, so the concept of return of investment in simulation comes from the idea that you want to convince your management that the investment in simulation is worthy, right? And for that purpose, we have something called value-added courses, right? Each of our institutes, as a medical college, because I'm a medical college faculty as well, we have certain limitations on how much we can charge our students, right? Because you're already collecting a tuition fee. and the government has strict imposed regulations on how much money you can charge, which is where the concept of value-added courses comes in, which means these courses are in addition to what simulation you already do, and these can be charged for. There's no limitations on them. Example, the American Heart Association BLS ACLS courses, the Jeeva Raksha courses, right? These are courses which you can collect extra money from while doing your regular simulation. So they will generate some revenue which you can use to run your regular simulation activities. But you should understand that simulation as an investment is a vision rather than a monetary value. It's a vision for your students. I know it's very difficult to sell the vision to the management. I've been there way too many times. But with these apps, you use these apps first because they're very low investment. You perform simulation, you show outcomes, and then you convince your management for the next level. It's always a phase-wise approach. In my medical college right now, we start off with a very basic, only CPR-based sim lab. And now we're doing all sorts of simulations because we were able to show outcomes and returns using basic costs. So that's why these apps are very useful because they're cheap. You can use these apps, you can show results and convince your management for more. Sir, if that answers the question.
Yes, thank you. Very practical answer.
Thank you, sir. Thank you, sir.